Hi, I'm Dr. Mike, and today we're talking about ankle injuries. What we're talking about today is ankle injuries, potential causes, the assessment, and then our treatment for ankle injuries. And so potential causes could be, any number of things: sports injuries, running injuries, typically what we tend to see a lot of. Other than that, it could be poor footwear, women wear high heels too often, things like that. Any number of things can cause issues with the foot or with the ankle itself. Couple different things that we do when we're looking at assessments and how we're going to work with somebody that comes in with an ankle injury. And so assessment-wise, a couple of things that we're going to start off with. So I've got my lovely assistant Rainey here with me again. And so first thing that we're going to do when someone comes in and complains about, typically in this case, kind of a chronic type of issue, I'm going to have them just walk for me. I'm going to have them so go ahead and take a couple steps forward. And then turn around and come back at me. And so as I'm watching her walk, I'm looking at a couple of things. I'm looking at her foot strike. I'm looking to see, do her feet roll in as she does it? Is she having any type of pain as she's doing this? Those are some of the first couple of things that we're going to be looking at, working on that. And so have you walk one more time for me. And turn around, come back. Good. And so based on my history that I've received from the patient gives me a couple of clues on top of just kind of what I've just seen here. Second thing I'm going to do is I'm going to look at them standing away from me. I'm just going to get down to kind of ground level. I'm going to be looking basically at their heel cords. And what I'm looking at with this is position of them. Do they come straight down from the back of the calf to the bottom of the foot? Do they come inward? Do they go outward? And that gives me some positional ideas of kind of what is going on in terms of their calcaneus or their heel bone. Is that contributing to or causing some of the problems? Okay, go ahead and face forward again. History-wise, another thing that I'm going to be looking at is I'm actually going to ask them to look at their shoes. What we'll tend to see is a wear pattern. It should be pretty even across the back of the shoe. If it's more so to the inside, more so to the outside, that's going to contribute or be caused from some of these heel cord or calcaneus type issues. If their foot's striking improperly, it's going to wear down one side versus the other. Another thing that I'm going to do is just the basic chiropractic assessment. We'll show that in a couple of seconds here, talking about what I'm looking for in terms of motion of the joints themselves. Hang tight, and up next is Rainey's Fitbit.
Hi, I'm Rainey. Welcome to the Fitbit of the Week. This week, we're talking about ankle injuries. So I'm going to go over 3 different ways to help you increase your mobility, increase strength, and then also stability in your ankle. So the first one that we're going to do here is just kind of like plantar flexion with a resistance band. So what I'm going to do is take the resistance band and put it right under my foot, kind of like by the ball of my foot. I'm going to pull up on it so there's some resistance in there, and then I'm trying to press my foot down and up. So I'm pushing against the resistance and then relaxing, pushing against, relaxing. So I'm feeling it through the ankle, and this is where we're increasing the mobility. So if you've had an ankle injury, this would be a good one to get that mobility back. All right, so just like so. All right, so pretty simple. The next one is gonna be more for stability and strengthening the ankle after an injury. So first what you'd wanna do is just try standing on one leg, just flat on the ground, like this. Once that starts to get easy, you're holding it there for 45 seconds to a minute or whatever, then you're gonna move to something harder. So the first thing that we have here in the office would be a foam pad like this. So I'm just gonna try it out here. Stand on one foot, just the same as you were doing on the ground. Again, once this starts to get easy, then you move to the next one. What we have here is also a square balance board. This one only goes forward and back. That's the only way that it allows to move. So when I stand on here, again, I'm trying to balance and increase the stability through my ankle, just like so. Again, once this one becomes very easy, you move to the last thing that we have here, which is a circle balance board, and this one moves in every single direction. It has kind of like a circular bottom also. So this one is a little harder. We're gonna stand up here. You wanna put your foot as close to the middle as you can, and then work your way up to a longer period of time, right? And of course you wanna do it on both sides so that you're getting kind of like the same strengthening and stability through both ankles. All right, and then the very last one that we have here, this is called ankle distraction. So what I've done is tied this band, or I've anchored it to something, and then I'm gonna put one ankle in like this, put the band kind of like right there above the ankle. I'm gonna stretch it out as far as I can kind of get it there, so there's a lot of resistance pushing there on the front there, and then I'm gonna kneel down. All right, so now what we're doing is we're moving, kind of like moving the knee, the shin forward. First, I'm gonna go towards the inside of my foot, holding like 2-3 seconds, relaxing. I'm gonna go just straight ahead, hold it a couple seconds, relax. Now I'm going to the outside. So again, this one is going to be strengthening and also getting a lot of mobility back through that ankle right through there as well. And you'd want to go through that several times to really work in each direction. So again, these will be really good, especially if you've just recently had an ankle injury and you're trying to get all that strength and mobility back. These would be the things to do. So that's from this week's Fitbit, and we'll see you next time.
All right, so what we're gonna be looking at now is my basic ankle foot workup for an adjustment based off of all the criteria and things that we spoke about in the previous section. And so what I'm looking at when I look at the feet is as they sit, on the table, is I'm looking to see, do they kind of come in evenly? Is something a little bit aberrant? If one foot's really toed in or toed out, give me some ideas of what's going on with the ankle. Then I just go through a basic motion assessment. So grab at the heel, I'm kind of moving it back and forth to see if there's any restrictions. Same thing with the other side, and then as always, you're kind of looking to see, is everything symmetrical or similar from side to side. Next, I'm gonna do just kind of a basic push up on the feet to see, do they come in evenly, give me some ideas about the calf musculature and then the feet themselves, and then we're also gonna come out in the opposite direction. Same thing, looking to see, is everything symmetrical from side to side. Based off of what I found with Rainey here, we've got a little bit of restriction in the calcaneus and then the talus itself. So I'll just demonstrate an adjustment here of how I would work with this. And then with the talus itself, just a little tug. And then once again, recheck it all afterwards. Check and see, have we restored motion back to those areas? And so that feels pretty good to me. Another option, another possible thing that we can do with ankle injuries, either of the acute or chronic nature, is we can do some cold laser on it. So we talked about cold laser in terms of many different things that it can help with, and what we're doing with this, breaking up some scar tissue, working at the cellular level to help induce healing. Using it, a couple of minutes of time based on where the injury is at, work and help decrease some inflammation, some swelling there, helping to restore some motion back into whatever the injured joint may be.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.